Nós vamos retomar, então, aqui a sessão da manhã. E eu tenho o enorme prazer e a gratidão de dizer que nós teremos agora a apresentação do Dr. Sam Myers. O Sam, ele é formado pela Escola de Saúde Pública de Harvard, Harvard T.H. Chan School, doutor em Medicina pela Faculdade de Medicina de Yale e bacharel pela Faculdade de Harvard. Ele se interessa por intervenções políticas para melhorar a saúde humana e, ao mesmo tempo, estabilizar os sistemas naturais da Terra. Como diretor do Instituto Johns Hopkins para a Saúde Planetária e da Aliança para a Saúde Planetária, o SAM supervisiona esforços multi-institucionais, na verdade são mais de 470 organizações de mais de 78 países que formam a PHA, Planetary Health Alliance, focados em compreender e quantificar os impactos das mudanças ambientais globais na saúde humana e traduzir essa compreensão em ações globais. Ele é coeditor com Howard Frumkin do livro Planetary Health, Protecting Nature to Protect Ourselves, Saúde Planetária, Protegendo a Natureza para Proteger a nós mesmos, eleito um dos 25 melhores livros de todos os tempos pela American Journal of Health Promotion, em 2021. O Sam é autor de mais de 100 artigos e capítulos de livros revisados por pares e tem sido o líder da Planetary Health Alliance desde o início, desde 2016, e é um dos autores, junto com o Andy Haines, que virá depois, e com o Braulio Dias, um dos coautores do relatório original de 2015. Sam, thank you so much for being here with us. It's our great pleasure to have you. I know you're very, very busy because next week we will be in Rotterdam for the Planetary Health Annual meeting in Rotterdam. So I appreciate very much taking some of your time, your precious time, to be here with us. So the floor is yours. Thank you.
Well, thank you, Antonio. It's virtual and not in person, and congratulations on this really exciting first big planetary health meeting there in Brazil. The leadership from Brazil could not be more important in this moment right now with COP and everything else, and a sort of failure of leadership from my country. So I'm so glad that you're convening, and really excited to hear where all of this goes. Over the course of about 3 weeks last year, 2 stories broke in the New York Times. The first essentially showing that declining bat populations in the United States were associated with rising infant mortality. And the second showing that deaths in the United States from hurricanes over the past century had been really dramatically underestimated. In the first study, a researcher showed that in counties where a fungal disease, the white nose disease, had wiped out bat populations, that farmers responded in those counties by increasing pesticide use by 31%, arguably because the loss of bats led to an increase in agricultural pests. He then noted that these same counties experienced an 8% increase in infant mortality, presumably because of the increased chemical exposures. In the second study, 3 weeks later, researchers found that mortality from hurricanes in the U.S. had been really dramatically higher than anyone anticipated, and that from 1930 to 2015, there are roughly 4 to 5 million excess deaths resulting from hurricanes. That number represents about 3 to 5% of all-cause mortality in the continental United States. And importantly, the number had started to really tick up since 2001 as a result of the more frequent storms associated with climate change. Both of these stories from my country are part of a much larger story of planetary health. And since the publication of the Rockefeller Lancet commissioned report on planetary health called Safeguarding Human Health in the Anthropocene, the field, and that was 10 years ago, the field has really exploded out of recognition that the Earth crisis has really turned into a global health and humanitarian crisis. But maybe we should step back and explain the Earth crisis itself. And it's really very hard to overstate the extent to which human activity has been transforming all of the natural systems on the planet, particularly over the last 40 or 50 years. Every year, in order to feed ourselves, we use close to half of the entire terrestrial land surface for croplands and pasture. We use about half the accessible fresh water on the planet, mostly to irrigate our crops. We're fishing 90% of monitored fisheries at or well beyond their maximum sustainable limits. And as you all know, in Brazil, we've cut down around half of our tropical and temperate forests across the world. We've dammed well over now 60% of the world's rivers, and we're struggling with this growing sort of global scale problem of pollution of air, water, and soil. And as you all know, we're disrupting the global climate system. All of these large-scale changes to our planet's natural systems are now driving species extinct at about 1,000 times the baseline rate. The population size of birds, reptiles, mammals, amphibians, fishes has fallen by about 2/3 since 1970. And one fact that I find sort of illustrative is if you weighed all the mammalian biomass on the planet, if you took all the mammals on the planet and put them on a scale, of that weight, 34% would be us, human beings. 62% would be our livestock, our domesticated animals. And the wild mammals would make up only 4% of the mass of mammals left on the planet. And so the size of our total ecological footprint, the extent to which we're remaking the natural systems on the planet, is really hard to overstate. The main sort of best recognized approach to sort of quantifying and tracking the stability of the entire Earth system around the world is the Planetary Boundaries Framework. And this framework came out around 2009 in a commentary in Nature. Subsequently, there's been a lot of science, a lot of consensus reports that have come out to substantiate the idea of these boundaries and to evaluate how we're doing with respect to each of these initially 7 and now 9 planetary boundaries. And actually, I was in New York for Climate Week last week, where the Planetary Boundaries community announced that a 7th of those 9 boundaries has now been transgressed. In this case, it was ocean acidification. And so 7 of the 9 planetary boundaries have now been crossed. And these are boundaries that are defined not with respect to human health or human well-being, but with respect to the actual stability of the systems themselves, to trying to evaluate at what point you get to an unstable system and you risk the possibility of moving into an entirely new state, a new biophysical state. And so it's very concerning that of the 9 planetary boundaries, we've crossed 7. This is a paper that we published, Johan Rockström and I, and a whole bunch of co-authors, including Andy, who you're about to hear from, this summer in the Lancet, in which we began to really argue for the integration of this planetary boundaries community with the planetary health community. And the sort of core point of the commentary is that the destabilization of the Earth system is causing really large burdens of disease across every dimension of health. So the table includes, the paper includes this table in which we showed all 9 of the planetary boundaries and essentially all the dimensions of human health across the top. And the sort of core point is that biophysical changes associated with each of these 9 planetary boundaries has clear impacts on every dimension of human health. So when you sort of start these arrow diagrams, you realize that actually every arrow is present in the scientific data. And so functionally, we've come to a moment where really arguably there is no public health without planetary health. Just as the public health community has kind of recognized over the last several decades that there are really important social and cultural and political determinants of human health, we now understand, therefore, that there are critical ecological determinants, that our health is nested within these sort of ecological conditions, these different dimensions of the Earth system, and that as we change those biophysical conditions at by far the fastest rate in the history of our species, we're starting to see very large burdens of disease associated with those changes. So the sort of core insight of the field of planetary health is that our sort of ecological footprint collectively as a species across the planet has ballooned so dramatically over the last 50 years that our planet can no longer keep up, can no longer absorb the wastes that we're producing or provide the resources that we're using sustainably. And as a result, our own activities, unbeknownst to us, collectively are transforming the entire Earth system and each of these dimensions of the planetary boundaries, and that as a result, all of those biophysical changes are starting to affect the foundational conditions for human health, the quality and quantity of food that we can produce, the quality of air that we breathe, our exposure to infectious diseases, our exposure to extreme weather events. And as we're seeing around the world, increasingly, the habitability of many of the places that we live, and we're seeing impacts across every single dimension of human health. In my own research, for example, which tends to look at food systems and nutritional outcomes, we found that rising concentrations of carbon dioxide in the atmosphere are making our food less nutritious and pushing hundreds of millions of people into new risks of micronutrient deficiencies. We found that around 500,000 people are dying. We're seeing 500,000 excess deaths every single year from the loss of wild pollinators, which help to improve yields of crops that protect us from non-communicable diseases like heart disease, stroke, diabetes, and certain cancers. And so the lack of pollinators means that we're not producing enough of those foods to protect us from those diseases. We found that around 1 billion people on the planet are facing nutritional insufficiencies if they lose access to wild harvested fish, as ocean warming is causing the fisheries to move away from the tropics and out toward the poles, sort of disconnecting the people who depend on those nutritional advantages from the wild harvested fisheries. And we could make, these are sort of examples from my own research. We've also done work in Madagascar on wildlife declines and how that affects nutrition. But the point is that all of these different kinds of biophysical change are impacting either the quality or quantity of food that we can produce, and as a result, nutritional outcomes around the world. And of course, there will continue to be surprises, which is a common theme in planetary health, as we alter all of these different biophysical conditions that our health, and I mean that our food system have been optimized to perform under. We will continue to discover surprises about how those changes will affect the quality and quantity of food we can produce. And then, we could create similarly sort of complex schemata for all of the other dimensions of human health. Infectious disease is extremely sensitive to changing biophysical conditions. We've just come out of the COVID pandemic. Clearly, these kinds of spillover events where we're seeing pathogens move from wildlife populations into human populations are becoming riskier and more frequent as a result of incursions into wildlife habitat, the bushmeat trade, animal trade, etc. But other kinds of diseases like vector-borne diseases are also very, very sensitive to changing biophysical conditions. And I'm sure that will be very familiar to you in Brazil. The non-communicable diseases are being significantly impacted by these changes as well. The big pollution and health report that came out a few years ago documented around 9 million excess deaths every year from exposure to pollution of air, water, and soil. Certainly air pollution is an absolutely critical one of those factors. We're seeing more and more of these wildfire events, certainly in the US, but all over the world that are affecting air quality and therefore morbidity and mortality. As I mentioned, even something like the loss of pollinators is increasing our exposure to non-communicable diseases. And then the mental health effects are also considerable, but not super well understood. What we do know from survey data is that, for example, across 10 countries, both wealthy and poor countries around the world, that nearly half of 16 to 25-year-olds reported really negative daily feelings about climate change. And so the extent to which we're seeing this sort of ecological grief or eco-anxiety around the state of sort of collapsing natural systems, changing conditions in the places that we love is not really well understood yet, but it seems as if there's a very, very large sort of mental health burden associated with the Earth crisis. And obviously, we're seeing more and more displacement every year as a result of extreme weather events, problems with food security and crop failures, et cetera, et cetera. And so displacement then is associated with a whole variety of negative health outcomes, as you all know. Across all of these different dimensions of health and these relationships between biophysical change and health, there are absolutely critical issues of equity and justice. As most of you know, by and large, the populations that are most at risk from changing environmental conditions tend to be the poorest populations in the world, indigenous peoples, future generations, non-human beings. And these are the same populations that have actually the least to do with driving the environmental change that they are suffering from. And so there's a profound issue of fairness and justice in the fact that it's the wealthiest people in the world whose consumption patterns are really driving those other populations into harm's way. I think there's another interesting dimension to this conversation I've been thinking a lot about recently, which is that we're talking so much these days about the COVID pandemic, but also there's been all this momentum around pandemic prevention. And I would argue that we have been throughout that whole period in what's really been a sort of invisible pandemic of global burden of disease being driven by our dismantling of our natural life support systems. And it's challenging because it's invisible. When a child dies of malaria in the East African highlands because global warming has allowed, Anopheles mosquitoes to move up higher in altitude, the death certificate says malaria, right? It doesn't say, Earth crisis. And, this is true across the board of all the kinds of health effects that I've been talking about. And as a result, it's very hard to see the totality of the burden of disease that's being driven by our transformation of our life support systems. And so we need to do a much better job of making this burden of disease visible to the world so that we can start to intervene more effectively. So I would argue that this is essentially where we find ourselves in this critical moment, that the Earth crisis is driving a global health crisis, that we in the health sciences are essentially sounding the alarm that we can no longer effectively do our jobs. We can no longer safeguard human health into the future while the natural life support systems that we all depend on are crumbling under the weight of our own collective ecological footprint. As I mentioned, we wrote this commentary this summer. 4 of the sort of key issues that we really highlighted as kind of cornerstones for the integration of the planetary health framework with the planetary boundaries frameworks were, first of all, that changes in every one of these boundaries impact each dimension of health, as I mentioned earlier, and that opens a space for this kind of integrated working together of the earth sciences and health sciences communities around things like planetary health impact assessments for new projects and new interventions, the need to have a really much more comprehensive assessment of the health impacts across each of these different planetary boundaries. And then ultimately, something that I know Andy has been a real proponent for is this idea of a dashboard for planetary health. And I would argue that the table that I mentioned to you is one way to sort of think about that dashboard, that each one of those cells where we cross the 9 planetary boundaries with each dimension of health, each one of those cells is an area that we need to be paying attention to understand how the burden of disease is changing as we see more health impacts from changes in those biophysical conditions. The second area that we emphasized was the need to center social justice in this conversation. And this has been core to the planetary health community from its inception. It's something the planetary boundaries community has started to work on more. But as I said, if the costs are being distributed unfairly, then at least when we think about new policies and interventions, we have to be sure that the benefits of those policies and interventions are fairly distributed. A third area is this idea of true cost accounting and quantifying externalities. And it's a really critical point from the sort of policy implementation perspective that so many of the projects or policies that might support stabilizing the planetary boundaries will also have very meaningful positive health outcomes. And if we can quantify the health implications of either making things worse or making things better, then we'll have a much clearer understanding of the true cost of these policies. So, for example, food subsidies that are promoting red meat consumption in wealthy parts of the world are essentially extremely costly, right, from the standpoint of health outcomes, and those costs could be factored into what the true cost of purchasing red meat, for example, would be. In my own research, we've done work in Indonesia, where the palm oil and the timber industry are responsible for a lot of land use decisions in Indonesia that lead to the fires that ultimately create these big haze episodes around certain weather conditions in Indonesia. And we spent 10 years essentially building the models to show that on average, there are 36,000 deaths every year in Indonesia from those haze episodes and cardiorespiratory mortality from the air pollution exposure. And if you factor in the cost of those lives, it makes those industries look very, very expensive in a way that wasn't very well understood from the policy perspective. So this need for actually accounting for either the positive or negative health impacts of the different policies and interventions we're considering. And then finally, there's this space for an integrated sort of communications effort. And I think this is really critical, that the world needs to wake up to understanding that what we've been talking about for decades as sort of discrete environmental problems, the climate problem, the biodiversity problem, the oceans problem, et cetera, have morphed, while many of us weren't really paying attention, into one great big interconnected human survival problem, right? And so we call in this paper for a much more sort of integrated communications approach with the earth sciences community, the health sciences community, groups like the well-being economies community, to bring our voices together with a common message that stabilizing the entire Earth system is essentially critical to securing a livable future for all of us and the rest of life on Earth. One thing I sort of have been reflecting on since Climate Week last week in New York is that there is a little bit of a propensity in our community to do a sort of better and better and better job of sort of classifying the problem in planetary health, and this sort of danger of admiring the problem and getting more and more data on the extent of the Earth crisis and the destabilization of the Earth system is dangerous, I think. And, you know, as we think about a dashboard that helps us really understand where we are with respect to the health impacts of changing environmental conditions, I wonder if we also need a sort of dashboard of solutions and to be able to really track how are we doing. I was excited to read this morning about Suriname's big announcement around protecting most of its forests, but how are we doing with respect to solutions? And that gets us to this sort of topic of solutions. And as we, and I know Andy's going to speak much more about this after me, but as we sort of look toward the future, I think it's critical to understand that there is an incredibly rich landscape of solutions in front of us, and that we essentially really need sort of rapid transformational changes in how we do pretty much everything, you know, energy systems, food systems, built environment, circular economy and manufacturing, green chemistry. And we know how to do these things. There are extraordinary innovations that are taking place across all of those sectors that just need to be supported and initiated. There's also a need for enlightened planetary health policy and law and governance, which unfortunately isn't going to be coming from my country in the next couple of years, but is showing up all over the rest of the world, which is really exciting. A role for the private sector, a role for movement building and civil society organizations and creating power. And so, you know, all of these things are underway, but they need to be supported and grown. And of course, you know, this is something I imagine Andy will talk about, but you know, it's really important to remember that most of the kinds of interventions that we're talking about tend to have really exciting health co-benefits. So there are things that are good for us to be doing anyway, whether it's, you know, plant-based diets or, you know, active transport in our cities or greening our cities or renewable energy with huge, you know, air quality benefits, et cetera, et cetera. And so it's important to remember that we need to highlight these co-benefits as we talk about these solutions. Antonio asked me to very briefly mention, you know, the Institute and what we're doing here at Johns Hopkins. Essentially, we've created a cross-university institute that connects all of the different schools at the university around this framework of planetary health. We've divided our work into these 5 program areas of research, education, policy, practice, and a clinical program that engages our nurses and physicians and trainees. And each of those have their own work streams, which I'd be happy to talk with people about at some point. But it's been really exciting. We're in our 2nd year now of the Institute, and we've seen a lot of enthusiasm and growth and a lot of really exciting progress. So it's been really fun to be part of that. And then, of course, the Planetary Health Alliance is celebrating our 10th anniversary. We've been growing fast. We're over 550 organizations now from over 80 countries. As Antonio mentioned, we have our big global annual meeting coming up next week in Rotterdam. So I hope I'll get to see some of you there. There is both a in-person and virtual registration opportunity. So anyway, there's a lot of work going on both in the Global Secretariat, but also in regional hubs all around the world. And it's very easy to get involved. So let me stop there and see if there is time for any questions. Thank you so much.
Thank you so much, Sam, for your, as always, inspiring talk and very comprehensive. It's always good to listen to you because you have this broad view and you know what's happening in the field, what's happening along these 10 years more than everybody else. So I have one question here myself, but I would like to ask whether alguém quer fazer alguma pergunta. Yes. Se pudesse se apresentar brevemente.
Thank you very much for your very comprehensive view of. I was wondering that the studies about the not apparently, but very well studied relationship between suicide and CO2 excess from burning forests mainly in the States and in China. Those are studies very, very powerful that are in the literature already and that we should be paying attention to. I'm just saying that because I don't hear any talking about it. So I would like you to comment on it, please. Because I think that as a civilization, I don't know if we are a civilization, or many civilizations, some more than the others, we are walking towards collective suicide. But it's happening already, and we should pinpoint it. Thank you very much.
No, well, thank you for the question. I agree with your analysis, and certainly there are studies about suicidality. I'm not aware of the ones that connect directly to CO2 concentration, but I am aware of studies that connect to heat, which is obviously very closely related, and also among agricultural workers around crop failures in India, for example. There are also very, very high rates of suicide in the Arctic, particularly among indigenous populations, which are sometimes up to a factor of 10 higher than the non-indigenous populations. And I don't know that a really good analysis of the causes has been done, but clearly the erosion of culture and traditional ways of life is an important factor. And the despair at seeing those traditions and cultures start to crumble, as well as the loss of things like ice roads and social connectivity as a result of warming. So I think it's a big topic, and you're right that we should shine a light on it. I think within the sort of mental health dimensions, suicidality is an important part, but it's also true that, post-traumatic stress disorder after these disaster events, anxiety, joblessness, sleeplessness. There are a lot of other dimensions of mental health that are also very, very important for us to understand. And it's why I say I think there's a very large global burden of disease associated with the mental health impacts that we don't fully understand. But that is a really important point.
Sam, any other questions here on YouTube? Well, while someone else asks, I have one, Sam. I like very much when you mentioned those 4 cornerstones for integration of planetary health and the boundaries, those 2 frameworks, because I think they pinpoint very important aspects. And one of them, which is very clear to me nowadays, is the need for true cost accounting. Because these days, some people here at the university are working on studying the hidden costs in agriculture and food. And I believe that this is one of the main points why many initiatives that should have been done, should be happening right now, are not happening because those hidden costs are not taken into account. So if you take a city like São Paulo, where you have a huge traffic and pollution, etc., the cost of deaths because of the pollution is not taken into account anywhere. So people take like 1, 2, 3 hours commuting to go to the jobs, and that doesn't account. So the loss of time, working time, or even the health problems that's associated with that. So my question is, considering those 4 cornerstones, how do you think we should tackle that in terms of specific areas, like through costing of specific processes, or areas like agriculture or health or cities? And I think that would be connected with the idea of having a dashboard, like those accounting processes would have to be connected to some kind of impact assessment, right?
Yeah, no, I mean, I don't have the answers, Antonio. I do think we need some leadership to emerge from, I think as countries or even cities begin to embrace this idea of true cost accounting, that can become a beacon and a sort of example for how it can be done. In a country like mine, where you have sort of legislative capture by industries, it's very, very hard to achieve momentum for that kind of true cost accounting. If you're talking about, fossil fuels, or even if you're talking about the beef industry, for example. But I think starting to have examples of how it can be done well, and certain countries emerging as leaders in actually developing policy with the true costs in mind, and making the case for certain policies, whether it's active transport in cities, or removing subsidies on beef and putting subsidies on fresh produce, for example. But there's so many examples. The cost of coal-fired power should be much higher given the air pollution compared to solar power. I think we need some examples where jurisdictions are actually embracing this approach to making policy. And we're trying to do some work at Hopkins on the idea of planetary health policy as a field in its own right, and the need for planetary health law and policy where we make this point. But having some examples to show the world would be really, really exciting. Maybe that's a place where Brazil can show some leadership. I apologize. I'm being reminded that I'm late for a meeting at 11:30 your time that I forgot about. So I'm going to have to run to that, Antonio. But it's so nice to be with you, and I hope I'll connect with some of you at our annual meeting.
The time, and as I said, see you in Rotterdam in a few days. Thank you.
Wonderful. All right. Goodbye.
Now we have the pleasure of having with us already online Dr. Andy Haines, Andrew Haines. Andy, I'll present you in Portuguese, right? Andy Haines, que é cavaleiro da coroa britânica, Sir Andy Haines. Ele é professor de Environmental Change and Public Health, mudança ambiental e saúde pública, com nomeação conjunta no Departamento de Saúde Pública, Ambiente e Sociedade e Departamento de Saúde Pública. Ele foi diretor da London School of Hygiene and Tropical Medicine, Escola de Londres de Saúde, de Higiene e Saúde e Medicina Tropical, de 2001 a 2010, 9 anos. Foi professor de saúde, atenção primária à saúde na University College London, entre 87 e 2000, e atuou como clínico geral por muitos anos na região norte de Londres. Então, conosco agora, Professor Andy Haines. Andy, thank you so much for being here again. I know you're all very busy. Andy has just arrived from a trip. He was in Switzerland today or tomorrow or yesterday. Just arrived back in London. So thank you so much for being with us. The floor is yours, Andy. Thank you.
Well, thank you so much, Antonio. Just to check you can hear me okay. Good, great. Well, look, thanks so much for the invitation. Sorry I can't be with you in person. And I want to really build on many of the points that Sam has made and maybe make some additional ones. This slide you've already seen, so I don't need to go through it in any detail, except to say, well, first of all, I acknowledge with great thanks many of the members of the original 2015 Commission who contributed so much to that Lancet report. Also, more recently, Johan Rockstrom, who's shared some of his work and his slides and so on, and many colleagues at London School of Hygiene and our broader collaborative networks as well that have informed me over the years. But the point I wanted to make about this slide is that although we increasingly understand the links between environmental change, the transgression of planetary boundaries and human health, things are still going in the wrong direction. So whatever we're doing up to now, of course, is in many ways very good, very impressive, but at the same time, we're not having the desired impact. So in my presentation, I also want to discuss the need for action, as Sam himself concluded by doing. But before I do that, maybe to say a few words about some of the recent scientific developments in this field. Unfortunately, my presentation seems to have... that's it. Right, so I'm going to focus particularly on climate change with some of my comments, because that's something that we work quite extensively on. And this slide really shows you quite an alarming situation, where you can see how the global average temperature is increasing very, very dramatically. Many orders of magnitude more than natural variability. So climate change is unequivocal and is affecting human health around the world. And also there seems to be, it seems to be accelerating. So when we look at the earlier part of the last few decades, we can see that temperatures are increasing by less than 2 degrees centigrade, and now they're increasing by over 2.5 degrees centigrade every decade. So that's concerning, obviously. And it may indicate that some of the Earth's natural systems that Sam's talked about, their capacity of the planet to absorb carbon dioxide in land, forests, in oceans, is being threatened. And so therefore, greenhouse gases are accumulating at an increasing rate. And you can see also how global average sea surface temperature is increasing. Sam also made the point that the ocean acidification planetary boundary seems to have been breached as well, as we've heard very, very recently. So all in all, these are profound danger signals. And very sadly, the political establishment in many countries is not taking necessary notice of this. And there are obvious reasons for that, because, of course, it threatens powerful interests. If you look at our humanity's journey on Earth, you can see that human civilization really grew up in the Holocene epoch. The Holocene epoch was that epoch, that time of relative climatic stability, during which humans changed from being hunter-gatherers to agriculturalists. And then in the latter part of that period, the Industrial Revolution, starting around 1750 in my own country. And that, of course, has led to some improvements, perhaps large improvements in human well-being, but of course a dramatic decline in the health of our planet in many ways. So the average is 1.2 degrees, but the most recent temperature is much more than that. It's about over 1.5, as I've said. And we're heading to a future, possibly over 3 degrees centigrade global average temperature. The Earth is not heating up uniformly. Parts of the Earth are heating up more rapidly than others. For example, Europe is heating up at actually about twice the average rate around the world. So there are big geographical differences. But the other thing that's really worrying many of us is the potential risk of tipping points. And there are a number of tipping points. There can be tipping points in a range of different natural systems. There can be tipping points in relation to health as well, when, for example, an exposure exceeds a certain threshold, for example, where we can't adapt anymore to extreme heat. But there are also tipping points in the climate. And this slide just shows you where some of those tipping points are. And you can see that they're really quite dramatic. So already just over about 1.5 degrees last year anyway, you can see that we're already in real danger of some of these tipping points being exceeded. Greenland ice sheet, tropical coral reefs, the Labrador Sea Current, which brings heat to much of Western Europe. And if that collapses, then we could get a dramatic change in the climate, could actually make Europe colder. And you can see that some of them others are more resistant to change. But the existence of these climate tipping points is something that's of great concern. Even if there weren't tipping points in the climate, of course, we'd still be worried about future trends. And these tipping points, the effects on health are still imperfectly understood, but they will have major effects on human health because they will accelerate sea level rise, resulting in coastal flooding, salination of aquifers. Some Pacific islands, for example, will have to be abandoned. So there are still quite a few unknowns, although there's much to be concerned about. But there's much that we do know, and I want to just touch on some of these points now. One, of course, is how climate change is being caused by a range of different greenhouse gases. Carbon dioxide being the commonest one. It's a long-lived climate pollutant, stays out in the atmosphere for centuries. Nitrous oxide coming from CO2, of course, coming from fossil fuel burning, but other sources as well. Nitrous oxide, particularly from land use, but some also from power stations. And then there are other short-lived climate pollutants like methane. Methane comes from ruminant animals, as we've heard, beef, for example, being beef cattle being an important source of that. Black carbon is a fine particle, it's not a gas, but it's emitted when you burn incompletely. You burn solid matter like fossil fuels or even wood. And that stays up in the atmosphere a very short time and can, when it lands on ice, it can accelerate the melting. Hydrofluorocarbons I won't say much about, but they're in refrigeration and so on. And then this is important for human health, tropospheric ozone. Methane itself doesn't cause damage to human health, but it's a precursor of tropospheric ozone. And tropospheric ozone is a short-lived climate pollutant. It also damages human health, increasing the risk of adverse respiratory outcomes, for example, but also damages crop yield. So if we could reduce methane, reduce ozone formation in the atmosphere, we would improve health and also increase crop yield substantially. We quantified last year, well, actually just over a year ago now, in a paper in the British Medical Journal, we did an updated estimate of the number of deaths from fossil fuel burning, ambient air pollution from fossil fuel use. And we showed that in total, we thought probably over 8 million deaths from ambient air pollution, a bit more than the WHO estimates, because of new exposure response relationships, amongst other things. And you can see in the top where the all-cause mortality per 100,000 populations are. Across much of Asia, parts of Africa too, obviously Europe, northern, well, pretty well global actually. And you can see what happens if you take out fossil fuels. It just leaves, that's the middle part of the slide. You can see that it just leaves a band across Africa, parts of Latin America, parts of Asia, with a combination of household air pollution getting out into the ambient air, but also dust as well. And in the bottom, you can see what would happen if we could remove all anthropogenic emissions. And you can see it just leaves that band across there where there's a lot of natural dust, which of course can be increased by human activities. So the burning of fossil fuels then is one of the major contributors, contributes probably 70% or so, perhaps a bit more, to climate change, but also kills a lot of people right now. And the other contribution, of course, is the land use from the agriculture, food sectors in particular. And this infographic attempts to show the impacts of climate change on human health. And you can see that it touches on many of the other health outcomes that Sam's already mentioned, linked to the transgression of other planetary boundaries. So there's a certain overlap between some of those. There may be synergies between them that we don't fully understand. The whole planet is being exposed to increasing climate, increasing temperatures, but how it's manifested, how it impacts our health varies according to where you are on the planet, according to socioeconomic, demographic, local environmental, and other factors that influence the magnitude and the pattern of risks. And as we've already heard, the impacts are particularly concentrated in those populations who've contributed the least. It's important to remember that the top 1% of carbon emitters, for example, are responsible for 70% of emissions. And the bottom 50% of emitters are responsible for a relatively tiny percentage, 10% or perhaps even less of emissions. So there's a big climate injustice, as we've already heard. Now, I won't read through all these different exposure pathways. You've heard about some of them from Sam, but I do want to emphasize the importance of considering the whole spectrum, right from the most direct, extreme weather and heat we've heard about, air quality, water, food supply and safety, a range of communicable diseases, but also these socially determined factors, both through migration we've heard about, but also increasing poverty, because as you heat the atmosphere, it becomes more difficult to work outdoors safely. And this pushes more and more people back into poverty. And there are also some studies making the link between climate change and the increasing risk of conflict in certain populations, particularly those whose crops are affected by climate change. But it's also true to say that many of the papers that you read about climate and health don't actually estimate the effects of human-induced climate change. What they tell you is that climate variability influences health, which of course we know. But there are only about 20 papers that actually make a formal attribution of the health effects to human-induced climate change. And for that, to do that, you need collaboration with climatologists to be able to separate the natural fluctuation, which you can see in the orange line on the left of this slide, from the red line, which is the human-induced climate change. We are doing quite a lot of work in this area. We're just doing some work with colleagues in Brazil, actually, in CIDAX in Salvador, which we hope will be accepted for publication soon. I can't tell you the detailed results, but I will tell you that there is a discernible signal, as you'd expect in Brazil. There are a clear proportion of heat-related deaths that can be attributed in a formal sense to human-induced climate change. And the map on the right is from a paper a few years ago, where from collaboration from researchers in 43 countries. And you can see that overall, about 1/3 of the total heat deaths across recent decades can be attributed to human-induced climate change. But there are big gaps, for example, much of Asia and in sub-Saharan Africa. And we and others are trying to fill in those gaps at the moment. Now, the reason that's important is because, as Sam has said, at the moment, we don't fully cost many of the activities of our society. So we don't take into account the effects on health. We don't take into account all the potentially preventable deaths. And attribution research will be a potential game changer because it will allow us to produce credible estimates of the number of deaths and the hopefully ultimately the amount of morbidity that is actually being caused by climate change. And it will form a very powerful piece of evidence for court cases, for litigation, and hope to actually result in justice, at least some partial justice for those populations exposed. We also know that climate change increases drought severity. This is just one example. Droughts in the Horn of Africa a few years ago, about 100 times more likely. And you can see how climate change has pushed those lines into the dark red area, which is where you get these extreme droughts, increased probability of extreme droughts. And in this particular drought, over 4 million people were in need of humanitarian assistance. Very difficult to get good data from these kind of situations, but undoubtedly, again, another example of where we're underestimating the effects. But it isn't just, of course, on adults, it's also effects on the fetus and young children. And this study just shows you some work that we've been doing in West Africa and the Gambia. And you can see in the photograph, colleagues actually in the field, including the principal investigator, Anna Bonnell, and they're measuring the heat exposure of pregnant women subsistence farmers using the wet bulb globe temperature. And you can see on the right side the physiological pathways, what we think is happening, that the mother is trying to regulate her core body temperature, her body is trying to regulate that by pushing more blood to the skin to lose heat, and that deprives the placenta of blood flow. And so you see this increase in fetal heart rate in relation to the heat exposure during the working day. And these women don't have any choice, of course. They have to work in order to feed their family. It isn't, I would say, just in very poor populations. You also see a relationship between temperature and pregnancy outcomes, stillbirth, premature labor in high-income countries as well. We've heard about wildfires, and landscape fires are a very major cause of ill health. Recent studies showed about 1.5 million all-cause deaths annually were attributable to air pollution from landscape fires, about 90% of those in low middle-income countries. But on the right side of the slide, you can also see the red area, how we're seeing an increase in some high-income countries too, including in North America and in parts of Europe. So as the temperature increases, of course, then these wildfires become more likely and larger. But of course, it also depends on deforestation, because if you deforest an area, then wildfires may become less prevalent and less severe, but that's because there isn't a fuel available. Communicable diseases, I won't say much about them because we've already heard a bit, but this is the example of dengue. Some colleagues at the London School showed how the dengue transmission increased over recent decades for both Aedes albopictus, which of course has now spread into Europe and other parts of the world, and Aedes aegypti. And you can see how their ability to transmit dengue has increased over recent decades, and that's contributing to the spread of the dengue virus around the planet. And you in Brazil, of course, have suffered from many millions of cases, and you're better aware than I am of the impact of that on your healthcare system. We also need to take into account the potential for increased pandemic diseases. This is not our work, it's work of Colin Carlson and others, showing how with the background of climate change, this can increase the likely cross-species viral transmission in wildlife. And those purple areas on the map show you where there's going to be increased viral sharing and increased population density. So that is where there's a likely increase in probability of the transmission of these potentially pandemic diseases, the zoonotic diseases, as we go forward. We've heard about mental health, so I don't need to say much about it, except to emphasize that there may be mental ill health following exposure to wildfires, as we've heard, floods, droughts, the concept of solastalgia. Solastalgia is the grief caused by environmental change when your environment, your familiar environment, is destroyed and you experience this intense feeling of grief. And we already heard about the really high prevalence of climate anxiety, severe anxiety in young people. And this, the right side of the slide shows you the results of surveys, including in Brazil, where we can see about 50% of young people in Brazil had such severe climate anxiety, it was affecting their functioning. So undoubtedly contributing to the burden of mental ill health, particularly amongst the young around the world. The food system, we've heard about that a bit from Sam, but just wanted to emphasize that there are going to be big impacts of climate change on the productivity of food crops, as well as he has shown, reductions in nutrient quality. And on the left, you can see how the climate models show that this is going to decrease further as the century goes on. Whilst there may be increases in temperate countries in climate, in crop yield, we don't know how long that will go on, and we don't know whether populations in the global south will be able to buy food on an increasingly competitive global market. We've heard that the food and agriculture system is one of the major drivers, of course, of this transgression of planetary boundaries. Already we have half of the land, habitable land, being used for agriculture. Greenhouse gas emissions responsible from the food system, responsible for about a quarter of the total greenhouse gas emissions, particularly methane. About 70% of global freshwater withdrawals, eutrophication, pollution by nitrogen and phosphorus, of course, the majority of that. And we've heard, I think, already that 94% of global mammal biomass is, excluding humans, is livestock, and about 70% is poultry of bird biodiversity. So completely unsustainable food system, also dysfunctional, with hundreds of millions suffering from undernutrition and a couple of billion or so suffering from overweight and obesity. So a dysfunctional system which is causing enormous damage to our environment as well, and at the moment is not being reformed at the adequate speed and scale. And then finally, plastics. And I just want to draw your attention now to the work of the Lancet Countdown on Health and Plastics, which has recently published its report in 2025. A lot of plastic production is linked to fossil fuels. About 98% of it comes from fossil fuels. And it's increased from 2 million tons in 1950 to 475 million tons in 2022. And if it goes on like this, it'll be 1,200 million tons by 2060. So very little of it is recycled, and I don't think there's much prospect of recycling most of it. And even recycling can cause problems, because recycling plants can be sources of microplastics, which we already know are pervasive. They're in our bodies, they're in food chains, and so on. And we still don't know the full impact of those. So what do we need to do? Well, we need to really focus on solutions now. As Sam has said, we've done enough really describing this. Of course, we have to carry on understanding the impacts of all this on our health, particularly to support litigation, to support regulation, to support taxation, subsidy withdrawal, and so on. We made the case some years ago for a planetary health, what we call a watch system or observing system, using integrated and trusted data from growing computational power, using open sources where possible. And we think that AI can help to accelerate that. And we started having discussions with colleagues about that. In fact, we have in a few weeks' time at the World Health Summit, a session with our Chinese colleagues who are developing what they're calling a planetary health axis system, which is an AI system for monitoring the impacts of these global environmental changes and synthesizing the evidence. We still don't fully know how successful that will be, but it's certainly an important initiative, and we aim to support that important work by our Chinese colleagues. We know that we have to adapt and we have to mitigate, because we have to adapt because change is already happening. We can't prevent all of it. That's true in climate change. It's true in relation to the other planetary boundaries, as we've heard. So we have to do both. Adaptation in climate terms involves things like better heatwave early warning systems, changing agricultural practices to planting different crops, for example, improving our ability to thrive under different climate conditions, changing our building design so that we rely much more on passive ventilation, shading, shutters, instead of just expensive air conditioning systems. And many of the buildings that are being built today are not fit for purpose, are not fit for the future, as are many of our past buildings. And mitigation is about cutting emissions. And we need to do that through multiple sectors: transport, energy, food. I suppose the good news story about that is that many of the policies that we need to put in place to mitigate climate change, and indeed to adapt to climate change, will benefit human health. And that story is one that deserves to be better known and is part of the emphasis on solutions. Of course, nature-based solutions are one example of those. It's very important to implement these with the full engagement and consent of indigenous peoples, local communities, maintaining biological and cultural diversity, and providing multiple benefits in a fair and equitable way. And you can see that there are a number of different types of nature-based solutions shown in the photographs on the right side of the slide. And recently, a systematic review by my colleague Penny Muragi and others of tree-based solutions in low and middle-income countries has shown significant positive effects of these tree-based solutions, like agroforestry, for example, for agricultural yields, dietary diversity, household income, poverty reduction, child growth, and self-reported well-being. The evidence is still not perfect, still needs to be developed further, but it's beginning to look quite compelling. And so we need to be harnessing this growing knowledge around the effectiveness of nature-based solutions and the multiple benefits that well-designed policies can bring. We also know that health systems themselves are responsible for about 4 to 5% of greenhouse gas emissions. WHO has a big collaboration, the ATTACH program, which has involved over 80 countries committing to building health systems which can both withstand the impacts of climate change and which are low carbon and sustainable. Now, these will be a major focus of the work being coordinated by the Brazilian Ministry of Health in the run-up to COP30. It's obviously important work. The health system can show leadership here and can also work with other sectors like the pharmaceutical and equipment sectors, because as the slide shows you, about 60% of these emissions are what is called Scope 3. Now, Scope 3 are the emissions in supply chain. So you can't just decarbonize your hospital or your health center, the energy supply. You also have to work with those industries that are supplying the healthcare system. And that can help to accelerate changes in other sectors. So the healthcare sector can play an important leadership role, but it also has to work with other sectors. And the reason for that is that many of the determinants of health and many of the driving forces of the transgression of planetary boundaries are, of course, coming from other sectors, as we've heard: energy, transport, agriculture, and food. But as I've said, the good news, the other side of that, is that if we can address these policies and create a sustainable future, a low impact, a low environmental impact future, we can benefit human health in the near term, as well as benefiting the climate and other planetary boundaries. And I've mentioned, just by decarbonizing our energy supply, we could potentially prevent 5 million premature deaths from heart disease, lung cancer, respiratory disease, and so on. Several million deaths a year linked to physical inactivity that could be addressed, at least in part, by more sustainable transport systems, public transport, walking and cycling, where you can do that safely. Diet is a big one, of course, and the Eat Lancet Commission will be reporting its new report in coming months in the Lancet. They've already suggested that over 10 million deaths annually could be prevented by shifting to what they call the planetary health diet over coming decades. And we know that some populations are already consuming these kinds of diets. The Mediterranean diet, for example, is quite similar in terms of its greenhouse gas emissions and its health benefits to much of the planetary health diet, as some data has recently shown us. So there are populations that are already living and consuming relatively sustainable diets, and we need to accelerate that. So in conclusion, positive global and health or environmental framing can bolster, can improve public support for climate and other environmental policies. This is shown in this paper here from colleagues, Sandy and colleagues a few years ago, showing that even amongst individuals that are unconcerned about climate change and environmental change more generally, this positive framing can increase the likelihood of support for climate, and I would suggest also for other planetary health policies. We can still get well under 2 degrees if we mitigate greenhouse gas emissions, not just carbon dioxide, but also these short-lived climate pollutants. And if we can keep well under 2 degrees, then we can, with reasonable assurance, prevent some of the worst effects of climate change. And I think a similar conclusion applies to many of the other planetary boundaries too. Well, it's easy to become discouraged, isn't it? Because when we look around us, the action is not happening at the necessary speed and scale. But this slide is quite an interesting one. It's taken from the UN Development Report just last year. And what you can see is on the vertical axis is what they call the index of planetary pressure. So that's an index which depends on greenhouse gas emissions, on material consumption. And on the horizontal axis is the Human Development Index. And what you can see is that the very high Human Development Index countries do have very high planetary pressures, but these are beginning to come down. And you can also see that those countries which are high but not very high Human Development Index, they have improved over recent years, and they have achieved a high level of human development at a much lower environmental footprint than the very high Human Development Index countries. So these so-called developed countries, many of them have developed in unsustainable patterns of economic development, and the other countries coming up are doing so at a much lower impact. And you could say a similar sort of pattern with medium Human Development Index countries as well. So there are some changes happening. They're not sufficient speed and scale, but we can also see that there are some changes, that there are countries that are reducing their environmental footprint, achieving better human development within planetary boundaries, or at least not within yet, but beginning to move in that direction. So we need to build on that momentum. And those of you who've read our Planetary Commission report 10 years ago will remember that we actually suggested there were 3 types of challenges. What we called the imagination challenge, which was the conceptual challenge. Can we visualize a society which creates health and equity within planetary boundaries? I believe we can. I believe that it's possible to do that, including many of the policies that I've mentioned and also that Sam has talked about. But of course, it's not sufficient just to describe the problem. We also have to describe solutions. And we have to ask ourselves why some of these solutions are not being implemented, like carbon pricing, subsidy withdrawal, and so on. And it's because they're opposed by powerful, very powerful interests, of course. So we need better models of transformation. And we also need to we need to combat and confront the kind of political economy of the current potentially disastrous situation. Knowledge, we know a lot more than we did. And I've indicated some areas where we've made big advances, like attribution science, for example, some of the solutions as well. But perhaps one of the failures is that we're not implementing that knowledge at the necessary speed and scale. So we need to focus now on implementation and evaluation. And that is what we are focusing on at the moment, is really showing where the win-wins are. We've developed, for example, a climate and health evidence bank. The link was on a previous slide, I forgot to mention it. But you can access many of the case studies that we've found of policies that can reduce greenhouse gas emissions and improve human health. And we could expand that to broader planetary health considerations. In our book some time ago, which I think is complementary to the one that many of us contributed to, and Sam and Howie edited, myself and Howie have also given our personal take on how we think we can advance planetary health. So we do need transformative action. And there are many frameworks of transformative action. This is one of them from Jeff Sachs and colleagues, talking about 6 transformations: education, health, energy, food, land, and oceans, sustainable cities and communities, and digital revolution. So these kind of frameworks are useful. You can conceptualize them in different ways, but it's useful, I think, to critically analyze these different transformational frameworks that are being advanced. The framework that particularly appeals to me, of course, is putting human health and equity at the center within these just and safe Earth system boundaries. So what do we need to change in order to transform the system? Well, we'll need to change power relationships, incentives, as Sam has mentioned. We need better economic metrics that actually reflect the true cost of our economy, of these economic developments. We do need better technologies, but technologies alone won't solve the problem. We need more equitable knowledge structures that share knowledge in a much more transparent and accessible way. We need stronger institutions that can stand up to powerful interests, and of course cultures that don't value just economic growth above everything else. We need to also look critically at our own personal and human values. And this would result, if we can get it right, in new behaviors, new ways of living, both individual, but importantly, new collective behaviors. And that will also lead to a more sustainable business opportunities through new consumption patterns, more sharing of resources rather than necessarily needing to own everything ourselves, and a much better internalization of those externalities that Sam talked about. So the final slide really just shows you this point, tipping points. I've mentioned the tipping points and negative tipping points, but the big question now is whether we can find positive tipping points towards rapid social change. That means we have to understand the opportunities for and the benefits of change. We have to have much more rigorous evaluation so that we can combat what's called greenwashing, where, for example, people make claims about reductions in emissions when they're not actually achieved, so that we can catalyze the uptake of effective policies, technologies, and interventions. We will have to work with, and we are working with, many other disciplines: energy, climate, agriculture, political sciences, even historians, in this endeavor, in a way that we didn't in the last perhaps 10 years ago when we were running the Commission. And if we can get it right, then we can see that the business as usual could be transformed into a much more stable state, not just decarbonized, but also living within planetary boundaries. If we lucky, this may go smoothly, as you can see on the right, but most probably it won't go smoothly. And we will see a lot of perturbations, a lot of fluctuations. And I think that's what we're seeing at the moment. We're seeing a lot of pushback. And beyond that time of opposition by powerful interests, we'll see another period of advance. Because in the end, the advance is inevitable. But the question is whether it will be quick enough to avert disaster and to achieve the benefits that we all want to see from living within planetary boundaries. Thank you very much.
Andy, what a great talk. So much information you brought to us. It just comes to my mind that we have a lot of knowledge, have a lot of information to tell us what is happening and how where we should be moving to. So yes, and I see your very last slide shows some directions in which you could be moving, and so this is I think is a reason for hope, because at the end the situation is really complicated, but yeah, there's reason for hope if we do change in the directions you suggested. So because my impression is that we do know what's happening, we do know what can be done, but in many ways, we're not taking the decisions. We're not making the decisions, either personally or institutionally or at the governmental levels. And that's what needs to be changed, right? I have two questions here. One is from your colleague and friend, Ayrton Stein, which must be watching us online. He says, I have one question. As a reflection on an interview that was published on Wall Street Journal by Walmart CEO on the Wall Street Journal, it was very clear that AI is going to change literally every job. And we know that AI has high impacts in climate change. What can be done with this very complex situation?
Well, Ayrton, thank you so much. Very good to hear from you, and looking forward to seeing you in person before too long. This is such an important question, and I didn't really have time to go into AI, but it's something that's concerning us a lot. Of course, we are all aware that AI needs an enormous amount of energy. Some of the AI is being powered on renewable energy, but it's also displacing renewable energy from other social purposes and priorities. So it is a big challenge. At the same time, I'm becoming aware from working with colleagues who know a lot more about AI than I do, that AI can also have big benefits for those of us in environmental research. I mentioned our Chinese colleagues working on this Planetary Health Access AI system, by which they hope to synthesize vast bodies of data about planetary boundaries and about the effects on human health. And I don't know yet whether they'll be successful, but we're certainly going to be meeting with them and understanding what they're doing with great interest. So there is that potential opportunity. We are also using AI to do a number of things, machine learning and AI more broadly, including some of the big, starting to work with natural language models. And we're doing that for a number of reasons. One is that to synthesize data, to do a systematic review, as you well know, Ayrton, can take a couple of people a year or more. We've just done one which has taken many years, and in the end, we had to bring about more than 10 people into this systematic review. It was a kind of umbrella review of urban policies which improve sustainability and health. And that involved initially screening over 100,000 papers. So increasingly, systematic reviews done by hand are going to be impossible because the literature is increasing so quickly. So we're working with AI approaches to systematically assess, to look for literature, and then to compare it with kind of quality criteria. And obviously we need to do a lot of validation. So we need to have human in the loop, as we call it, human in the loop AI, where the human AI and the human work together in order to ensure that the AI is producing the correct answers. And we know that AI can hallucinate, ChatGPT can hallucinate, give you the wrong answer if you're not careful. So we need to work with some care. But I think there's an enormous opportunity because some of these things just cannot be done easily, certainly without vast numbers of humans doing these reviews. So this, I think, is an area for development. And we're also exploring the potential of using AI to work with city leaders and other leaders to provide the answers to the questions that they're asking, like what sort of policies, what would be the impact of these policies, say in transport or energy or housing? What would be the impact on equity, on emissions, on the local political opinion even, on health of these policies? And what are the policy options that I have? Now, again, it's very difficult to do that by hand for hundreds, perhaps thousands of communities around the world. So can AI help us to accelerate this process of providing the evidence for decision-making at the city level, perhaps at the national level as well, in different locations around the world? This is something we're beginning to look at now, and it does look potentially very exciting. But before we can be sure that it works, we need to do a lot of evaluation, of course. And evaluation is what we're focusing on now, evaluating many of the actions that are taking place. And of course, as you well know, Ayrton, randomized trials have been fantastic in clinical medicine. Many of us have done them, and we're very much believers in. You can't do randomized trials necessarily in planetary health. I mean, occasionally you can, but often you can't. So you have to use other types of design. And we are developing a kind of taxonomy of different methodologies that would allow us to undertake these evaluations. And some of them will include evaluation using AI approaches as well. So it's a very dynamic field, and we and others are getting involved in this area because you can't ignore it, whether you like it or not. Thank you.
Thank you. Yeah, it seems to me that just as any other technology, we don't want to go back and not use them. Just as cell phones, which are, for us, it's a crazy life that we live today with cell phones, but we don't want to go back.
Yeah.
It's just the way we use them. And the same is happening with AI, so the way we use it.
Yeah.
I have another question here from João Miguel Lima. He says, part of the efforts require hope. To which extent it would be possible to come back to acceptable thresholds among those of the critical Earth system's boundaries that have already been surpassed?
Yeah, that's such an important question. And, I'm not an expert in all those Earth system boundaries, but I think, having heard some of those Earth systems people talking, I think to come back to where we were is going to be very difficult, probably impossible, I would guess, because we've already damaged so much. And, we've already lost so many species, for example, some of which we never even discovered. You only discover them after they're gone. Maybe we can recreate some of them, but probably not the whole ecosystem that supported them. And, we are now in a position of climate overshoot. If you look at what the Joyita Gupta and Johan Rockstrom in their recent paper on safe and just Earth system boundaries, they suggested that actually we needed to not go above 1 degree. So we're already above the safe and just Earth system boundary. So we're already in a situation of overshoot. Now, over decades, we may be able to bring down that temperature, but it won't be the same world as it was that we left. It'll be a different world. And some of these things it will affect some systems and some societies unalterably. So I'm afraid we will have to come to terms with that. And that's why it's so important to create more resilient communities as much as we can, accepting that we can't create resilience everywhere. But those communities that have to move, for example, they need to be supported. Their rights need to be respected as far as we can. And they need to be also, they need to receive some kind of compensation for the impacts. And that's a long way off because these powerful interests that are causing much of the damage are not prepared to give any compensation, and they will have to be forced to do that through litigation and through political change. So I think the short answer to your question, based on not my personal research, but certainly listening to those who are doing research in this area, is that we can't exactly return to that world that we've already left. What we can do is to prevent further damage, and we can also try to bring us back within those planetary boundaries. There will already, as I say, the Earth will be different, or these Earth systems will be different, but hopefully they will potentially could restabilize if we can get them back within these Earth system boundaries. They may look different, but hopefully be more stable. So that's the best answer I can give at the moment, but it's an area of very active scientific research. And of course, to some extent, we won't know until we get there.
Thank you so much. Just to finalize, I liked one of your, all of your slides, but one of them, which I took a picture with my camera here, is when you mentioned new behaviors, new lifestyles, new individual behaviors. So I think that is something that is needed very much, and that will be based on education, on communication, on science being, data science, science data being taken, made available to the population so that we make those changes and make those behavioral changes, right?
Obviously, we're also facing a kind of pandemic of mis and disinformation as well, which makes things even more difficult. And we know that even kind of modest policies can be attacked, sometimes on completely unfair grounds. I mean, we had this concept of 15-minute cities. I don't know if you recall this, but there was an idea that if you live in a city, that all your services should be within 15 minutes. But that was twisted and changed by I'm not sure who was behind it, but there were certainly powerful forces behind it. And what they were saying was, well, these people who are proposing 15-minute cities want to reduce your freedom. You won't be allowed to go more than 15 minutes from your home, which of course was, completely stupid. No one was ever proposing that. And I think we're a bit naive. I think we need to actually reframe what freedom means. Freedom isn't just about consuming as much as you want, flying all around the world 100 times. Freedom is also the freedom to be healthy, and the freedom to live in a sustainable way, and the freedom to expect that your children and grandchildren will have a planet on which it will be worthwhile living. So I think we're using sometimes the wrong language by emphasizing what needs to be given up. We ought to emphasize that freedom that this would bring, but it's a different kind of freedom. It's a freedom to enjoy life at a lower environmental footprint than before, but also with the prospects for flourishing in the future of humanity. And that's what the current system, of course, is depriving us of, is that future that where the whole of humanity can flourish. So I think we need to reframe the way we're speaking to people in a way to overcome some of the populism that we're seeing, which is making it more difficult for us to achieve the ends that all of us want to achieve. Thank you.
Just a quick comment, a reply from Ayrton. He said that he liked the expression human in the loop, that he didn't know. And then he says, maybe AI can help Brazilian soccer team to be improved.
Yeah, I'm sure it can. When
Yeah.
I was young, you know, we all looked up to Brazil. We thought it was going to win all the time. So that time will come back, no doubt.
Andy, thank you so much for being here with us. I know you're very busy, so thank you so much. It was a pleasure.
Well, thanks so
listening
much
to
for
you.
inviting me. And I look forward to seeing some of you, at least in Rotterdam, in a week or so. Thank you.
Okay, thank you. De um lado, assim, ouvindo essas pessoas, né? A quantidade de informações que o Andy nos trouxe, por exemplo, ambos, né? O Andy foi o mais recente, está mais fresco na cabeça. A quantidade de informações, é claro como a gente já sabe o que está se passando, né? A gente tem informações para mudar de comportamento em todos os níveis, né? Todas as pessoas, né? E ao mesmo tempo, como ele diz, né, a gente caminha no sentido, ainda não estamos mudando, né? Mas há esperança que isso pode ser mudado, né? Então, eu acho que cabe a nós pensarmos agora nos próximos 10 anos, já que estamos comemorando 10 anos aqui, como a gente repara essa falha de implementação, né? Se vocês lembrarem, o slide que ele mostrou, são 3 pilares do Planetary Health Report lá em 2015, que é imaginação, ou seja, essa questão mais conceitual, ou ter de conhecimento, para mim está claro que ambos estão por aí, e implementação. Na implementação, né? Porque nós precisamos implementar, pôr em prática isso, né? Bom, breves comentários agora, nós estamos um pouquinho atrasados só no tempo, 10 minutos, o que para nossos termos é bom, né? A gente vai retomar pontualmente às 14, tá? Para não atrasar, porque a gente tem uma convidada também internacional entrando às 14 horas, na mesa das 14. Há restaurantes bem próximos aqui, a gente pode ir caminhando para lá, o mais perto é caminhando 5 minutinhos, para quem quiser ir lá. Lembrem-se que, então, quem tiver apresentações para a mesa da tarde, que é a mesa do cuidado na perspectiva da saúde planetária, com a moderação da... deu branco. Renata. Por favor, deixe esses slides até antes de sair com a gente lá aqui, com o Luiz. Né? Pode ser com o Luiz, os slides aqui, os PowerPoints, tá? De tarde nós temos essas 2 mesas, essa e depois a mesa de inovação em sistemas alimentares, né? E entre as duas nós temos um break aí de 1 hora de café com prosa, muito bem nomeado, isso, café com prosa, que é para a gente prosear em torno dos pôsteres, tá bem? Muito obrigado até o momento e bom almoço, e nos vemos aqui 5 para as 2, que é para 2 horas a gente começar, tá bem? Obrigado.